Okay,
Yes, sir, I'm good whenever you're all ready.
Yeah, I'll just give a brief introduction. I think most of us here know you, but for those who don't, uh, this is Dr. Liam Anthony Morris. As you all know, he was an alumni of the 2006 batch, and he has done his chief residency at the VA Medical Center, Louisiana, in the year 2012. And he's done his fellowship in interventional cardiology from the Louisiana Health Services Center in the year 2016-17. And currently, he is working as an interventional cardiologist at the Central Washington Hospital, Washington. I officially welcome Dr. Leah, and we are extremely pleased to have you. I would request Dr. Manda to give some opening comments, sir, please.
Thank you.
Yeah, thanks, Priya, for your introduction of Liam. Liam, first of all, welcome on board.
Thank you.
So we are, first of all, Gulf Medical University is very proud of its alumni, of its achievement, and we celebrate the achievements of our alumni. So this is the platform. Instead of having an alumni summit once in 2 years, which we also going to have, we wanted to, over a period of time, continuously engage with the alumni. So in this series, welcome Dr. Liam, who has, after graduation from the second batch of Gulf Medical University, has come up to a level. Now he's become an consultant in interventional cardiology in Washington, Central Washington hospitals, and he will share his journey with all of you to tell us that, of course, the foundations were laid at Gulf Medical University, and later on there must have been a lot of struggles for him to reach this level, but definitely I think his journey will be a lesson to you all. With this very few words, first of all, we are proud of you, Liam. And then we would like to continuously engage with you, and your journey will be a lesson to others also to follow your pathway and to achieve greater heights. So with these few words, I leave the platform to you, and later on your own teachers, your colleagues, they're all on the platform. I think you can, as you told in the beginning of the talk, beginning of this one, that you'll walk down the nostalgia lane. Yes, you could. Yes, all yours. Thank you.
Well, thank you so much for having me, Dr. Manda, and thank you to the university as well. We're so used to calling it Gulf Medical College that it is amazing to think how much it's grown. And I'm certainly proud to say that I am a student from the Gulf Medical University, and I'm glad that I took the path I did. So having said that, I'm going to start off by sharing my screen, and then we'll get into the presentation. Give me just... Okay, I hope y'all can see my screen. Yes. Let me know if y'all can't. Okay. Yeah. So I wanted to just talk about my journey, as Dr. Manda was saying, in the hopes that someone would probably hear about it and may get motivated enough to do something similar, or better yet, kind of carve their own path to success. And these are very simple steps, at least the ones that I followed since medical school. So what I'm going to do is I've titled this My Journey, and these are the little things that I did whenever I started out. So the first thing is I had a goal. Some people have more than one goal, but I just had the one, and we'll go through each of these in a few minutes. There was a path. There needed to be motivation. There were certainly obstacles. There was a lot of effort that needed to come in from my side. And then eventually, all of this culminated into an action plan. So if we go through each of these, now there are going to be two quotes on each slide. The first one's going to be mine, basically my thoughts at the time. And then the second one is a quote by a famous writer or human being who, which would make sense during that time or during the time period this was thought of. So in terms of goals, it was very simple. Now, this all starts back growing up in India. I grew up in Kerala, and I was there for 17 years. And I think Liju can probably relate to this, but or most of us I think. But when you ask a kid in India what they want to be when they grow up, it's either a doctor or a lawyer or an engineer. These are the three professions that most kids just are kind of taught to say. And I was no different. So I just picked one. I didn't know why I was picking it, but I wanted to be a doctor growing up. And I always said that. But as I grew up, I thought that I was pretty good at biology. It came pretty easy to me. I didn't have to study for it, and I would do really well. So I figured, well, hey, this must be pretty easy. I mean, hopefully medicine is like that, and I can just, go through it without studying too much. I'll be great at this. But that was not the case. Once I got into med school, I realized that it was a completely different kettle of fish. There was a lot of effort that needed to go in. But at the time, that was the simple thing. I just wanted to be a doctor so I could take care of patients and save lives. That was the goal. And this is a good quote by Steve Covey. Begin with the end in mind. It just means that in order to begin something, it would help to have the end in sight. If you're working towards the light at the end of the tunnel, it's a lot easier than not knowing where you're going. So I knew I wanted to be a doctor, and now I just needed to figure out how. So my parents were moving to Dubai at the time, and they asked if I wanted to move with them. And we all heard great things about Dubai then, and it still is a great place. So I decided to move with them, and that's how I heard about Gulf Medical College, which is what it was called back then. My parents were not in the medical field, so they didn't really have any clue about what they or myself was getting into. So this looks a lot greener, and there's a lot more flowers there than we initially were used to. So at the beginning, it was a lot of sand around the college, but it still looked a great site though. And looking at the pictures now, it's just incredible to see the journey, to see the difference that all these years have made. This was way back in 1999. That was a long time ago. I feel so old, but that's the truth. So med school happened, and our first 2 years were basic sciences. I think the curriculum has changed since then, but back then, the first 2 years were just the basic sciences, lots of lectures. But I think what helped us in the beginning, as Dr. Munda alluded to, was we were given a great foundation. We had incredible professors. Dr. Chandramauli is here, Dr. Gomati, Dr. Geeta, Dr. Ajmani. These were all people that were great at their craft. And the good thing is, yes. Is everything okay? I think you're muted, Pri.
No, it's just somebody's mic was on. It's okay.
Okay, that's all right. So we were blessed with really good professors, and I think Dr. Gomati had once said that we were in the trenches together, and that's so true. We were in the trenches together with a point to prove the students wanting to uh, establish a career in medicine, and the professors attempting to add uh, yet another feather to their already illustrious caps. And we got to know them not just as professors, but as human beings as well. And that was special. So we got a great foundation starting off in medicine. And my class, which was the second batch, as Dr. Munda had mentioned earlier, uh, had a bunch of incredible people, hung out with a lot of them, had a bunch of good times. These were some of the folks I used to hang out with. That is Johanna from the left, and then Vandana, Carol, and then this was Syed right here. I keep in touch with them, not as much as I used to, but I still do. And the years just flew by. In 4.5 years, we were at the end of the road as far as medical school was concerned. So here, my thoughts were that I wanted nothing more than to get into a good residency program and specialize. And the incredible thing is, once we graduated, this was in June of 2006. This was after a year of internship as well. Funnily, it was not the end of the road, but the beginning of yet another. So these were some of the other folks in our class. This was Fahad, Johanna, Ashrud, and myself. And Ashrud and I were pretty good friends. We did most of our rotations together, and we kind of worked together towards a common goal as well. It's always nice to have someone else who does the same things that you do, even within a medical school class. If you have similar rotations, you could kind of compete with each other or push each other to further heights. And that was Ashrud for me. And this quote, I think it's really apt here. What it says is, I see my path, but I don't know where it leads. Not knowing where I'm going is what inspires me to travel it. So you would think that once you get into med school, your path is already laid out for you. You're going to be a doctor. But at this stage, at the end of graduation, for me, it was not quite, because the next step was the most important one, at least at that time. And that would be residency. And getting into a residency program, I didn't know which country I was going to. I didn't know if I was going to stay. So I didn't know where that path was going, but I knew I had to take it. And it was one I'm glad I took, now looking back. So I needed motivation along the way. Now, the United States of America, I wasn't thinking about it until probably the fourth year of medical school. We did a few rotations at the Iranian hospital in Dubai, and there was this one time where a doctor from the US came by to give us a lecture. And this was a morning lecture, I believe. And he told us about how he made it to the US and what steps he had to take and how he went about doing his exams, getting past his USMLE, and things like that. And that was the time, I guess, I thought about going to the US. And Ashrud was there beside me in class, and she looked at me and she was like, well, we should do this. We should try to go to the US. And I said, yeah, that sounds great, but then there's so much work to do. I didn't even know where to start, because at that point, and the situation now may have changed a little bit, But at that point, these were my options. So I was thinking about either going to the US, England, Australia, or staying back in the UAE. Now, these are very different programs in each of these countries. The steps you need to take to get into each of these countries very different, although the knowledge of medicine is pretty much the same, but how it is tested is very different in each of these countries. So it's not easy to simultaneously apply to all of these places and do all of their entrance exams. And do a good job of it. At least for me, I thought it was going to be hard. So I decided to concentrate on one and then see how that would go. I chose the United States because I felt that the education it provides was pretty good. And I also felt that this country would give me the opportunity to rise to greater heights if I put the work in. So then started the journey. And this, of course, is a pretty good quote by Mark Twain, which says the secret of getting ahead is getting started. So I knew at that point I had to get started on trying to pave my way towards the United States. And I did a bunch of research and I figured out what needed to be done. And things started falling into place. Now, for the United States, there are these entrance exams or these specialty tests, which are called the USMLEs or the United States Medical Licensing Exams. In order to be eligible for those exams, your medical school needed to be listed in the WHO list of med schools. Now, our medical school, at least for the first 3 years, I believe, was not listed on there. So that was an additional obstacle. It was something that we were all worried about because we wanted to be given the opportunity to be able to sit for these tests. And then if we did well or not depended completely on us. But that's where Gulf Medical University, I'm still getting used to saying it that way, but that's where GMU did its part, where we were eligible to sit for any of these tests by the time we graduated, which was a great achievement in such a limited period of time. So that was one of the obstacles. And then the other one, this was kind of personal to me. I don't know whether it is a problem these days, but the first time I applied for a visa to the United States, I was rejected. And that was a big deal because once you're rejected the first time, it takes a lot more to get accepted after that. So I was kind of stuck at that point. I had not done my USMLE exams yet, and it was looking to be a difficult path towards getting here. So I was truly at a crossroads at that point, you know. So on the one hand, do I take the path to the right, which says, well, you should still try to get back into the US, do your USMLE, and try again, which was a big risk at that age, or do I just switch to one of the other countries that I was thinking about, but fully knowing that I would have to start my research on the respective country from scratch, because I had invested all my time and effort into trying to learn the US system and how we get in, and trying to prepare for the US system as well. So I made, I think, what would be the boldest decision of my life so far. I decided to prepare for the USMLE anyway. I decided to take a year to go back to India, enroll in one of the Kaplan courses, which at the time was pretty good for USMLE prep. And I took step 1 and I took the clinical knowledge part of step 2 and then reapplied for a US visa. So here, obstacles are those frightful things you see when you take your eyes off of your goal. That's what happened to me. So temporarily, I kind of concentrated on what the obstacle was and forgot what I was trying to head towards. Um, but I finally got back on track, went back to Kerala, did a few Kaplan courses, completed step 1, step 2, CK, which is the clinical knowledge part, and then reapplied to the United States. And this time I got accepted, which was great. At least I was given the opportunity to uh, come to the United States and make something out of myself. So during this time period, up to this point, it took a lot of effort on my part uh, to at least gain the confidence that I was going to be as good as some of the residents I would meet in America. So what I did was, or my thinking at the time was to try to gain as much knowledge and experience as I can, so I would not be inferior to other residents in the real world. Now, this was a fear of mine. And one of the reasons was because we were a new college at the time. Although our basic sciences was pretty strong, our professors were great. Um, our clinical uh, stuff was a little bit behind, and that was only because we were very new and our hospital did not have as many patients at the time. The pathology was not as different, and we could definitely do with a little more exposure. The college again did its part. They gave us the option of going to the country you wanted to, most of the time to the country of your origin, and have an opportunity to gain experience in those countries. So I went back to India and I uh, went to some of the best colleges in India. We were sent to Sri Ramachandra Medical College in Madras, and then after that, St. John's Medical College in Bangalore. These were really good colleges, and this was during our summer vacation, so it wasn't at the expense of our classes, and it was an option. It was completely up to us. I grabbed it with both hands and ran with it, and the college made sure it paid for our stay and paid for our tuition. So it was great. It was a great experience that was just given out, and that was another thing that GMU did, which was pretty impressive. So doing that, I managed to gain some exposure as a medical student and do a lot of things. Uh, and this is something that's very close to my heart. Hard work beats talent if talent doesn't work hard. What this means is that you could be good at something, as I was at biology growing up, but if you don't work hard, that doesn't mean much at all. So I learned that pretty quickly after I got into med school. So working hard is paramount. You have to put in the effort. And this this was a picture from uh, gosh, it was a long time ago. This was at St. John's Medical Center, and it was probably at 2 or 3 in the morning. What we used to do, and uh, Anne would remember this actually because she was over there. I don't know if Liju was there at that time. I don't remember, but we were all sent to St. John's, and what we would do is we would round with the professors during the day, do our respective rotations, and then during the night at around 9 or 10 at night, we would just go to the ER to help out. But the real reason was to learn how to do a bunch of procedures, to gain some exposure. And that exposure was priceless because we got to do a bunch of stuff that we wouldn't. The people there were very accepting, and I learned a lot over there. And those experiences are hard to forget. They were very good experiences, though. And then, of course, finally is uh, this is an action plan, basically. Once you have gotten to the point where uh, you've done the groundwork. So the next thing I was going to do was to reapply for US visa, which I did. And my plan was to complete my USMLE exams, which I did, obtain an externship. Now, this was it was not a necessity, but it would definitely help. An externship is basically US experience. Now, it's weird how the way the system is set up here. For foreign medical graduates, in order to separate yourself from the rest of the people applying, it would help if you had some US clinical experience. This is hard though, because as a foreign medical graduate, due to insurance purposes and malpractice purposes, it is not easy to get into a hands-on externship in the United States. So they ask for US experience, but if you have already graduated from med school, it's kind of hard to gain that experience. If you are still in med school, there is a possibility you could do some kind of program where you rotate here for a few months and then go back. I was lucky in some ways. Johanna, the guy who was in one of my pictures earlier on, he still is a good friend of mine, but his parents were in the US, and he was the only one I knew here when I moved here, and he knew someone, a doctor who was a cardiologist who had an outpatient practice, and I got to rotate with that cardiologist for a month, and that was really good. That's how I got into cardiology, because I really liked what he was doing, and I liked the heart as an organ. I'm a great believer in luck, and I find the harder I work, the more I have of it. So this is a good quote, because your luck is what you make of it. So working hard will definitely help you get to better places, that's for sure. So this is where I got into internal medicine residency, LSU Health in Shreveport, Louisiana, and did my medicine graduation there. These are some of my co-residents. Graduated from cardiology, some of my co-fellows, and I did my interventional fellowship there as well. This is one of my mentors, Dr. Shafton, who's an amazing cardiologist. And this was my interventional cardiology graduation. So got through that as well. And right now, because I don't want to keep talking and we're getting close to running out of time for my presentation. So right now, this is what I do. I deal with the heart, right? Because I'm a cardiologist, so this is what I see day in and day out. And this is basically what we deal with. So the heart, if there are students on here, and I'm not sure which year you are, but the heart has three main arteries, one on the right side and one main artery dividing into two on the left. So we have the right coronary artery here, and then there's the left coronary artery with the left anterior descending artery. See, the thing I like about cardiology is all of the nomenclature is so self-explanatory, and it's really just, you can make logical sense of it, because the left anterior descending artery is called so because it's on the left side. It descends anterior to the heart, and that's why it's called what it is. And this is the left circumflex artery, which kind of wraps itself around the lateral part of the heart. So what I primarily do is deal with blockages in any of these arteries. So if there is a blockage, I will go in there and fix it. Blockages are the things that cause heart attacks, and heart disease is one of the big time killers. So basically, I'm a glorified plumber, if you want to call me that, because I just fix blockages and clogged pipes. So this is a version of what I really do. So this is the heart, and this is a blockage, okay? So we put a wire through that blockage in the artery. Uh, so this is the wire right here, and this is a stent over that wire. And then we just open up that stent and squish the blockage to the side. And then we leave that stent in and pull out the wire, and that's it, and restore blood flow. So let me go back to my presentation if I can. So that's what we do. The stent is left in here, the wire and balloon are removed, and hopefully blood flow is restored. So I just need to get back to my presentation. There you go. So that's basically what I do. Now I'm going to quickly present a case. This happened around 2 weeks ago. We first diagnosed people who are having heart attacks based on a 12-lead EKG. Now, each of these leads, there's 12 leads on this EKG. This is lead 1, 2, 3. For all intents and purposes, this is lead 4, 5, 6, 7, 8, 9, 10, 11, 12. So we diagnose, if we diagnose heart attacks, and if someone has had a blockage based on ST elevations, and that's what this lady had here. If you look right here, this is the ST segment of the EKG, and it's elevated as compared to the baseline. You can see a little bit of that here as well, and you can see it here as well. So these are the anterolateral leads, and the artery that supplies the anterolateral part of the heart is the LAD, or the left anterior descending artery. So we took her to the cath lab, and this is what we found. Now, this is a picture of the coronary arteries in real time, basically. To get some sense of what we're seeing here, this is the left coronary artery right here, and this is the left circumflex that comes down here. You don't see the right coronary artery here because the right coronary artery is on the other side of the heart. And then here, there is supposed to be a vessel, but you don't see it because it's completely occluded with blockage. It's completely occluded with plaque. And that is the LAD. And this was the reason for a heart attack. So what I did was I put a wire through here. This is the wire that comes through here. And then over the wire, we put a balloon, and we kind of blow up the balloon so that the blockage kind of gets squished to the side. Now, this is just a balloon, so we have to put a stent in later, but this is the balloon right here. And then after the balloon, it kind of looks like this. So you see there is a vessel here now that was not there before, but there is still a certain amount of blockage. So this is dye filling the artery, and it should fill the artery uniformly from top to bottom. But if you look at where the arrow is pointing at, there is a narrowing. So that's where the blockage is at. So there is still a blockage, and I need to fix it. And I put in a stent, and this is how it looks. And you can see this vessel here, which was not there before. It was completely occluded here. And she did well after that. She was admitted to the ICU for a couple of days. We monitored her and then sent her home. So that is basically what I do at work. At home, I like to just sit around, sip my coffee in front of the fire. I'm lucky to live in a place that has a bunch of nature and a bunch of mountains, actually. So these are the Cascades, and this was close to winter, I think. So I kind of try to just not do much when I'm off of work and at home, but in between.
You can continue. I've muted.
Oh, I'm sorry. Yeah, for some reason I didn't hear that as well, but okay. So, and in between, what I do is I try to enjoy nature, and I hike a lot. And I picked up skiing and snowboarding. This is my girlfriend, Ashley, and we have a pretty good winter here. So this is something that I really like to do every winter. And finally, as the topic suggested, the heart of the matter for students is first to set your goal, or if there is more than one goal, that's okay. But these are simple steps. And I think if you follow these simple steps, you probably will be more successful than you're not. Choose your path, determine how to get there, motivate yourself, use your friends and your surroundings uh, to find sources of motivation. There's always going to be obstacles. I mean, the path to success is not a bed of roses. So there's going to be a lot of obstacles that you kind of have to overcome, and you will. Work the hardest you ever have. This is the most important, I think, out of all of this. I think it's unlikely that if you work super hard, that you are not going to get what you wanted to begin with. And then formulate an action plan. So put that work into use by knowing what needs to be done so you can get it done. And then success will be yours for the taking if that happens. And then finally, now this is not about a relationship, but this is just because I'm I specialize in cardiology, and I just wanted to say that actually uh, there is a condition which is called broken heart syndrome, or Takotsubo cardiomyopathy, where stress can cause the heart squeeze to actually drop. So this broken heart syndrome is real. We see a lot of patients. They're usually older women, but we see them in men too, where it's actually called broken heart syndrome, that they have been exposed to some stressful event in their life, and their heart squeeze drops because of it. They get heart failure as a result of it. But I put this up here just to say that if a broken heart can be stitched together, then most obstacles can be overcome in our day-to-day life. If life were predictable, it would cease to be life and be without flavor, which is a nice quote, which just goes on to say that medicine, although we presumably are going towards a common goal, there are so many paths and so many unpredictabilities that it would surprise you to see the journey you've taken once you look back. And that's about it. I hope I've not gone on for too long, but that is my journey to where I am today. And I can't thank everybody enough, especially my professors from back in med school, because they laid the foundation to what would come after. Thank you.
Thank you, Liam, for that very interesting presentation. I'm sure you've become an inspiration for our students. Professor Manda, would you like to say something, sir?
Yeah, Liam, can you stop sharing the screen? First of all, thank you, and wonderful quotes and wonderful. I never knew that you also became a philosopher.
Oh gosh, yeah.
Quite philosophical and very nicely relating to your journey. So it was pretty interesting to see it, very inspiring, especially to a younger generation. And I'm sure there'll be a few questions, and if not, your own ex-teachers would like to interact with you. And I think this is the opportunity for that. So it's open to discussion. Yeah, thank you.
Thank you.
Hi, Liam. Okay.
Hey.
Yes, Professor, please.
Yeah, can you hear me?
I
yeah,
can.
It was a lovely presentation. I thoroughly enjoyed it. Wishing you continued success in your profession.
Thank you. Thank you, sir.
Anyone else has any questions, comments?
Dr. Gomati? Dr. Gomati?
I think she's here. She's probably just muted.
No, she's muted.
She's muted herself. I'm not able to.
Yeah, she's muted anyway. Right. Okay. Yeah. So, Liam, thank you. Thanks a lot for your time, spending your time. I think it's sometime very early in the morning, right?
It is, but that's okay. I'm
So thanks
used to waking
for
up.
coming in so early and giving a talk and very inspiring talk. Very, very impressed. And as Professor Chandramoli had already told you, even on behalf of Gulf Medical University, we would like to be connected with you. And we are there to support you. And then we appreciate your growth. And we wish you all the best. And then you have to reach many more successes in your life. So our best wishes are always with you.
Well, thank you so much, and thank you for doing this. This has been a pleasure for me to do, and I would always like to keep in touch and hopefully come visit at some point soon.
Definitely. Make it once the pandemic is behind us. I think you should come and visit us. Yes.
Yes, for
Dr.
sure.
Gomati has come back in. I think
Yeah,
she
I think she
talk.
can say a few
Hey. Hi, Liam. Sorry,
Hey, Dr.
when I tried
Gomati.
to unmute myself, I got locked out.
No worries.
It was good to hear you, and it was wonderful. The way you put your journey was really lovely. It was very inspiring, very nicely put, and I really like the way you, put your obstacles as well so well, because, that's what's the problem. Most of the time when they are on their path, they get dejected midway because of the obstacles which come. Everyone starts out well, but then when the difficulties arise, it's difficult to keep going. And it's very long, the journey.
Yeah.
So I think you did a very good job of that. I'm sure everyone is feeling very inspired.
Thank you so much, Dr. Gomati. Yeah, I felt like, it's the obstacles are as important as anything else, because as foreign medical graduates, it's hard to go to a different country and try to make something of it. And no matter where people end up, I think there's always something or the other where you need to overcome. And for me, it was these things. So I felt that maybe that would be helpful to someone who's probably going through the same stuff, or even otherwise. But yeah, those times were definitely testing, but there's always light at the end of the tunnel, as they say. So that's always a good thing.
Okay, if there are no more comments, then I think we can wind up now. Thank you so much, Liam. Once again, we will reach out to you again for some other interesting sessions like this, if you're okay with it.
Yeah, well, I appreciate it. Thanks a bunch. Thank you all for joining, and let me know if anything comes up.
Yeah, sure.
Thank you.
Take care. Bye-bye.
Bye.
Take care, Liam. Bye.
Bye.
Bye, Professor Chandramoli. Bye, sir.
Oh, thank you so much.
Hi,
Thank
Dr.
you so much.
Chandramoli. Lovely meeting
Yeah, how are you?
you.
Gomati? How are you?
How are you?
I'm doing fine here. Yeah.
Priya, if you could stop recording, we can have a
Yeah.
we can have a social chat.